This video covers important actions to take before you leave to manage your health, as well as ways to support your physical and mental health while abroad. By the end of this video, you will know key actions you need to take before you leave to manage your health and understand ways to support mental health while abroad. First and foremost, get vaccinated. Unless you have a legal exemption, you are required to be fully vaccinated against COVID-19 before your travel. Being fully vaccinated significantly reduces the risk of contracting and/or becoming seriously ill from the virus. More information on how to get vaccinated is available at umd.edu/4Maryland. Travel with proof of your vaccination and keep it handy in case you need to show proof before seeing a medical professional or visiting an urgent care or hospital facility for treatment. Do not travel if you have contracted COVID-19. Many locations require proof of a negative COVID-19 test and/or being fully vaccinated against COVID-19, which may require 2 doses depending on the vaccine, within a certain number of days or hours of your entrance into the country. You must meet these requirements to enter the country. You can find this information on the International Air Transport Association's website or the U.S. State Department's COVID-19 country-specific information pages. Continue to practice the 4Maryland healthy behaviors during travel, while abroad, and when you return to campus. These include wearing a properly fitted mask over your nose and mouth around others at all times, both indoors and outdoors. Washing your hands often and sanitize used surfaces frequently. Staying at least 6 feet away from others, and staying home if you are feeling sick. Note, the 4Maryland Healthy Behaviors Guidance is updated regularly, so keep checking the website while you're abroad and when you return to campus. Visit the UMD Travel Clinic. Call the UMD Travel Clinic now at 301-314-8180 or book an appointment online at health.umd.edu to talk about your health and the location to which you will be traveling. Some governments require that you show proof of certain vaccinations in order to enter their country. The travel clinic staff will help you determine which vaccines you need, if any, and you can make follow-up appointments with them as needed. Complete the Health Disclosure and Accommodations Request form in MyEA. This helps education abroad be a maximum assistance to you should you need medical attention while abroad. Completing this form, however, is not mandatory. Please contact Leanne Johnson, LIJOHNSO at umd.edu or 301-314-7748 or your EA advisor if you have any questions or concerns about this. Let your doctors know. It is important that you discuss the implications of living and studying abroad with your medical and/or mental health professionals. Be sure to make them aware of the location in which you'll be studying abroad so that they can advise you appropriately with regard to maintaining your health and well-being. Talk to your family. Please discuss your study abroad plans, where you'll be going, your medical provider's input, your medical and/or mental health needs, etc., with the people who help you make good decisions about your health care. Engaging your family support system early on helps them to help you stay on track as you prepare for a healthy and safe time abroad. Determine who in your family will be ready to travel to your location in an emergency should the need arise. That person or persons should have a valid passport, be fully vaccinated for COVID-19 to avoid an automatic 14-day quarantine, and be ready to purchase a flight on short notice. Plan for your prescriptions. If you are currently taking prescription medication, please be sure you can travel with enough of that medication to last the duration of your stay. If that is not possible, you should understand the steps you need to take to access this prescription while abroad, including using your CISI insurance coverage. Details can be found on our Health and Safety Resources page. Know whether or not your current or new prescriptions are legal in your host country. The State Department website is a good resource to help with this. In addition, the Centers for Disease Control and Prevention provides helpful advice about traveling with medication and medical devices. Know how to address your allergies. Talk with your doctor about your allergies and how you will manage them while abroad. It It is also important to research the country and locations to which you will be traveling so that you are knowledgeable about the allergens in the context of that locale. Travel with sufficient amounts of the medication you need and keep them readily accessible in case you have an allergic reaction. You should also learn how to communicate your allergy in the local language of your destination so that others can support you in avoiding your allergens. Request ADS accommodations. If you receive ADS accommodations here on campus and wish to request continuation of these accommodations while abroad, please submit a copy of your ADS accommodation letter to Education Abroad as soon as possible. Living, studying, and adjusting to a new location, culture, and way of life can give rise to a range of emotions and reactions. While many of these feelings may be welcome, like excitement, anticipation, and joy, some of them may be overwhelming and stress-inducing. Before you leave for your study abroad program, here are some things you can do to maintain your emotional health. Get familiar with the culture practices of your host country and the places you plan to visit. Talk with your family and friends, your established support network, to set expectations about how and how often you plan to be in touch with them. Be frank and clear with clinical specialists, friends, and family if staying in contact is important and necessary support for you while abroad. Plan in advance for contingencies, such as arranging to talk by phone with a familiar therapist or other mental health professional at home. Be sure you have their contact information and consider sharing this information with Education Abroad or on-site program staff. Practice self-care and stress management techniques. Prepare yourself to adjust these to fit your new location if necessary. For example, your new neighborhood may not be conducive for jogging alone early in the morning. You may need to find a jogging partner or switch to exercises you can do in your room or apartment. Practice and embrace flexibility. Set realistic expectations for yourself. Connecting with other students who have studied abroad in your chosen location or with international students who are from your chosen host country can help with that. We strongly encourage you to disclose your health and mental health conditions to Education Abroad via the Health Accommodations and Disclosure Form. Sharing this information is voluntary, but we encourage you to view disclosing as self-advocacy and proactive communication of your needs to Education Abroad. Your disclosures will be treated confidentially. While UMD Counseling Center therapists cannot provide remote counseling, there are several resources available to you on their website, linked on our resource page. The self-help apps listed there are great examples. These include apps to help you manage anxiety and depression, shyness, low self-esteem, and more. Downloading these to your device ahead of time is a great proactive step to take in managing your mental health. When you're abroad, don't isolate yourself. Connect with other students, professors, in-country program staff, your roommates, etc. One way to intentionally do this is to decide to speak with at least one new person every day or week. These don't have to be deep connections. Try to avoid spending time exclusively with others of your own nationality, especially if conversation trends negatively. Connect with local people. This is one of the best ways to learn about the culture and about yourself. Eat a balanced diet, eat regularly, and stay hydrated. This may entail trying new foods. Your diet supports your mental and physical health, so do your best to stay nourished. Exercise. This can be an easy one to forget to do when you're abroad, but is just as important as maintaining a healthy and balanced diet. Talk to your people back home, but control how often you do this. Find a healthy balance between staying in touch and becoming overly dependent on them. Consider staying in touch via multiple means of communication: social media, email, and texting, in addition to phone calls. Explore your new home with a friend or two. Exploring with others you trust is the most comfortable and safest way to explore. Leave your room or apartment. If you're not quite ready to explore your host country, start small by going out for a coffee or a walk around your neighborhood. Again, it is always safest to do this with a partner, especially when you are newly arrived. Sleep. Getting a healthy amount of sleep is very important. Travel and jet lag can really be disruptive to your sleep cycle, so don't underestimate how important it is to manage your sleep schedule and help your body adjust to the time difference. UMD's Counseling Center has great suggestions for developing and maintaining good sleep hygiene. Take a look at them on our health and safety resource page. Don't abuse alcohol or other drugs. Abusing either of these will seriously threaten your physical and emotional health. Don't fall into the trap of using drugs or alcohol to help you cope with stress or reduce anxiety. Speak with a professional counselor if needed. CISI can help you find one and will make the appointment for you. Your in-country program staff and education abroad advisor are also good people to call on. Expect to feel depressed, frustrated, and angry sometimes. Homesickness is real and normal. You will encounter challenges in everyday life that are more difficult to overcome simply because you're in a new environment. It's a little like going to your local grocery store only to find that the entire floor layout has been rearranged and nothing is where you expect it to be. Some of what you experience may be part of a cultural adjustment cycle or culture shock, and is quite common among study abroad participants and others who travel abroad. This cycle can have low points and high points, sadness and elation. If you feel yourself going through this cycle, and know that this cycle can be short or prolonged, remain committed to your health maintenance regimen. Do not stop taking your prescribed medication if in moments of elation you feel you no longer need them. Do not stop taking them unless you first consult with your doctor. If you are managing a chronic medical, psychiatric, or psychological condition, your treatment for the condition must continue while you are studying abroad. It is important to have a frank discussion with your medical provider and to ask whether traveling abroad is appropriate at this time and for the duration of the study abroad program you are considering. If it is, the next step is to work with that provider to come up with a plan for managing your mental health while abroad. Here are some questions to consider as you prepare to travel. How will you access social support, engage in self-care, and cope with emergencies while you are abroad? Are all your prescription medications available in your host country? Can you legally travel with and have your prescribed medications abroad? What are your medications called in your destination country? Is the strength and dosage different? A good place to start with this research is the CDC's Traveling Abroad with Medicine webpage. CISI is also an important resource you have to support your mental health. By calling the assistance line at 01-312-935-1703, you can request mental support services, and you will quickly be connected to a US-based behavioral health professional who will assist you remotely. CISI can also make appointments for you to see local mental health providers in person. You can also request this assistance via email at medassist-usa@axa-assistance.us. During your time abroad, you may become concerned about the mental health of a friend or roommate. Some signs that they may be struggling include: they seem depressed for most of the day. You notice that they have decreased interest in engaging in activities. They seem restless or, conversely, seem to be moving much more slowly than you are used to seeing. They speak about feeling hopeless or thoughts of suicide or death. You notice that they are drinking alcohol or using drugs as a way to make it through the day or self-medicate. The most important thing that you can do is to share your concerns with a program staff member, such as your faculty director, resident director, or other program support staff. This will allow them to quickly connect with a student to understand their needs and support them. If the situation is acute and you think the person might harm themselves or others, call the 911 equivalent immediately. Other ways you can help include: first, realize that there are limits to what you can do. You are not a medical or mental health professional, and it is not up to you to fix the person or the situation. Listen to the person and validate their experience. Let them know that you are concerned by their behavior or comments. Empathize with the person and avoid judgment of them or their actions. Help them find help. Things that are not helpful include trying to force the person to do anything, trying to control the person or their actions, and trying to talk the person out of feeling bad. You should now have a clearer idea of how to support your physical and mental health while abroad.